Hello, and welcome to the Whole Health Cure. One of the things I enjoy the most about this podcast is the opportunity to sit down with colleagues for whom I have tremendous respect and have the opportunity to truly understand their work. A theme that stands out among our guests is passion, dedication, perseverance, and forward thinking, as most have trailblazed a path in healthcare. And our guest today epitomizes this, as you're about to hear through her expertise and personal story. Dr. Dawn Mussallem is a consultant in the Department of General Internal Medicine at Mayo Clinic and is an assistant professor of medicine. She's a diagnostic breast and lifestyle medicine specialist at the Robert and Monica Jacobi Center for Breast Health and serves as medical director of humanities and medicine. Dawn, welcome to the podcast.
Thank you, Dr. Bergquist. It's so exciting for me to be here with you today. What I really cherish is the time I have with patients one-on-one, but it's so meaningful and exciting for me to be able to share, what I'm so passionate about with groups of people, and being invited on your podcast allows me to do that. And I just love all the work you do. So thank you so much for allowing me to be here. And thank you for that lovely introduction.
Oh, thank you so much. I've been looking forward to our conversation for a long time. So I'm so excited to be able to share the information that you share with your patients. I want to start by asking you what you do. What is a diagnostic breast and lifestyle medicine specialist?
Yes, thanks. Thank you for asking me that. And that is a question that I do get, because you will see that throughout the country, there really is not a lot of people who practice medicine in that space. At Mayo Clinic, we have diagnostic and basically breast centers, breast clinics at all three sites. And on those three sites, what we do in the breast clinic within this diagnostic breast specialist role is we work with women on various aspects of their breast health. Number one, we work with them in terms of a risk assessment standpoint. So when a woman comes in, we know the newest guidelines from the National Comprehensive Cancer Network recommends that women really should have a risk assessment for their breast cancer risk starting at the age of 25. And so that's what we're there for, is to assess a woman's risk and to be able to individualize what her approach to breast health needs to look like throughout her lifetime. So for those high-risk women, we're there to help them to optimize what imaging they may need, what age they should start. Mammograms should be individualized if they need high-risk screening with breast MRIs, if they have increased breast density, what supplemental imaging should be considered above and beyond mammogram. And then for our unique patients who are at this elevated risk, whether it's just because of a family history or whether it's because of a confirmed genetic risk, or maybe even a biopsy that's a high-risk lesion like an atypical hyperplasia. We work very closely with those particular women, and this is kind of a very in-depth approach. Some of these women, we have discussions about medications that reduce the risk of breast cancer, but what I'm so passionate about is really getting in that space and working with these women with their lifestyle, because we know so much of breast cancer can be prevented by how women live, and we know that number is at least 33%. And it's suggested that if lifestyle change was implemented early on when a girl was young in her childhood, that number could be as high as 70, maybe even higher than that. So it's very, very exciting, especially knowing that genetic confirmed cancers of the breast are only about 5 to 10%, family history are another 5 to 10%. So that means there's 80% that we have that could potentially be preventable, right? And so this is very, very exciting. But we have confirmation that about 33% of those cases are preventable. So that's the high risk part. The largest part of the practice that I currently am active in is that with our breast cancer patients. So we work with women when they're newly diagnosed to help them, understand their diagnosis and to help them kind of go through their breast cancer journey early on in a seamless way to get them in with their subspecialist they will then see with their breast cancer. And what I do in that space is I work with women when they're newly diagnosed with breast cancer to help them with lifestyle. And this is my passion, is to be able to work with these women when they're in their most vulnerable time, to be able to be there for them and to help empower them through lifestyle, opportunities that can keep them well during the breast cancer journey, as well as help outcomes after the breast cancer journey. So very, very excited to be with these women, across their entire cancer continuum from the time they're diagnosed and beyond. So it's been really exciting. Cancer can truly be a teacher of life. I was fortunate that I learned that firsthand. And so it's been really, for me, a gift, my own personal experience, to be able to be there with my patients and work with them.
Yeah. And Dawn, I want to go back to the numbers that you had mentioned just to make sure I understand them. So 33% of cancers are breast cancers are preventable.
That's correct. So the American Institute for Cancer Research estimates that 33% of breast cancers are preventable if women maintained their weight, if they were physically active, if they avoided toxic exposures. We know that when it comes to nutrition, especially when we look at the American Institute for Cancer Research cancer prevention guidelines that were set forth in 2018, we know that 4 of those recommendations actually had to do with nutrition. So we know that nutrition has a direct link with weight management, which is very, very important. And we see in that nutrition space now, since especially even 2018, there's just emergence of many high quality studies. So I think what we're going to see is each update of these cancer prevention recommendations, there's going to be more and more direct recommendations specific to breast cancer that'll be guideline specific, because we're seeing more of this importance and this emphasis on nutrition. And I'm so excited to talk about that today, for sure.
Yeah, that's really just incredible. And you said if a person does that early in life, over a lifetime, that could be up to 70%?
Yeah, you'll hear different experts using numbers. And so I really like to stick to that 33%, because I think it's hard to really quantify what that impact is. But I think if we step back and say, okay, if we know that family history is 5 to 10% and genetic is 5 to 10%, some believe that there still may be a little bit more, maybe an additional 5% that's linked to genetics that we don't know about quite yet. So, more to come in that. But even that being said, I feel that it's pretty comfortable to say in that range of 50 to 70%, if there's lifestyle change early on, young children, young girls, if they're more physically active, if they avoid weight gain throughout their lifetime, that's very, very important. We know physical activity is probably one of the most important things, in limiting sedentary time is very, very important. But unfortunately, what do our children do nowadays? They sit. Their diets are composed of 60% of their diet is ultra processed food. So we have not begun to understand what that impact is going to be on our children. And it's concerning. So I'm really hoping that in what I try to do when I work with women, it's interesting because when I do share with them some of the different approaches, we're going to work together as a team if they're interested, and this is all with shared decision making, and I meet the patient where they're at. But the majority of patients want to move forward and change their life, but a lot of them, the biggest question they have is, how am I going to do that? My family's, it's going to be hard with my family. And this is really a big invitation to, let's do this for the whole family. We want to make everyone healthy, and especially your children, because your children have your genes, and even if they didn't, we want to be healthy to prevent not just breast cancer, but all chronic diseases. So the same diet that's good for your breast is going to be the same diet that's going to be great for your brain health, for your heart health, and well beyond that with any chronic disease, prevention. I think it's just crazy when you think of the number that diet is the number one cause of death secondary to chronic diseases in our country. I mean, how do you comprehend that, right? So there's so much need for us to emphasize the importance of nutrition with our patients.
Absolutely, Dawn. And I love what you said about children and the next generation or the younger generation, because so often when we think about cancer, we think that risk goes up as you get older. And of course, we don't start mammography until women are at least 40 years old, sometimes even later. And so we associate the risk more with aging than we do with children. And, from what you're saying, how action earlier in life can make such a difference even before a person has had that first mammogram.
Yeah, I think it's extremely important. And especially when it comes to breast cancer risk, because when a young girl is undergoing thearchy, that is when her breasts are starting to have that exposure as to when there's going to be that insult that's going to be possible. So another lifestyle aspect that we need to be very mindful of is these young girls are starting to drink and consume alcohol at a very young age. We don't, vaping is another thing. We don't know about that impact of the actual vaping or the nicotine on that breast tissue in these young teenage girls as their breasts are developing. And so there's just going to be so much understanding that's coming out of these lifestyle, aspects. And young girls are starting their menstrual cycles much younger. And so they're going under that breast development much younger as well. So it's going to be interesting space to follow closely and see what we see with these trends, but trying to prevent all of those knowing adverse effects would be the goal, and that comes through education and population health.
Yeah. And so when people get referred to you, you're primarily seeing people, or one of the pathways is when people are newly diagnosed. When they come to you, can you talk a little bit more? You said you meet patients where they're at, and where do you begin when you're trying to frame a program for them?
I love that question. And I've always wanted the opportunity to answer that question, and no one's actually asked me. So thank you for asking me. It's such a special visit. And, I will say that Mayo Clinic is very supportive, and I have 90 minutes with my patients. I used to only have 60 minutes. And what I found is that it was just too hard to get into the amount of detail we wanted to. The patients came in with a lot of questions, and the patients, if I didn't have adequate time, would leave almost frustrated and worried that they were not going to do things right. So I start my visit off with asking them what their goals are for the visit. I've really enjoyed that. Though I almost always know what they're going to say, sometimes there's a little bit of variability. The majority of patients coming in to see me want to talk about breast cancer nutrition specifically, and that's really they want to spend almost, 85 of the 90 minutes, but there's a lot more we have to talk about besides just that. So I asked them that particular question. I always ask them about their family dynamic to kind of understand what sort of social support they have, if they have children in the house, if they're married. That's also very, very important to me. And then the next thing we review is a questionnaire I send out to my patients. It's a National Comprehensive Cancer Network, a very comprehensive, kind of like distress screen, basically. And it goes over many, many aspects of well-being. And so I rely on that. I rely on a second questionnaire that goes over nutrition and sleep and exercise and toxic exposures, as well as supplemental use. So that's also very, very important as I'm approaching these patients. And then lastly, I really rely on the social determinants of health in my practice. I love the social determinants of health. And there's multiple aspects of that I like to kind of embed. So we kind of spend about 10 to 15 minutes reviewing all that. Sometimes I need to take longer so I can understand what their goals are for the visit, what is actually impacting their quality of life at that time, so that when I have the discussion with them, I have more support that I can model what lifestyle changes we're going to have. And going into the visit, I already know if my patient's exercising, right? I already know what kind of nutrition that they have. So I'm able to kind of hear their voice and understand, the relationship with all of this. So it's a very nice visit, but it's the time that allows me to afford this high quality care. The first question I ask them when I start to really dig into, how we're going to approach this from a lifestyle 6 pillars, standpoint, is I ask them about sleep. Because most of all my patients have fatigue, and almost 95% of them, when I ask them about sleep, they're not sleeping well. So I think it's a big invitation to all healthcare providers out there that sleep is such an important aspect and question to ask your patients about their quality of sleep. Most of my patients snore, so they go on, and I have them go on to, have overnight oximetry testing and or meet with a sleep consultant if necessary. And that's because, the majority of my patients are overweight, and, about 2/3 of breast cancer patients are actually overweight or obese, believe it or not. So that's why I do see a lot of this obstructive sleep apnea. And then that has such downstream effects of many metabolic issues, right? So we're talking about hyperinsulinemia. So it's a core fundamental thing that I need to target my patient population. So I really start there. The next thing I go ahead and move on to is I move on to the nutrition, because I do want to start talking about that component. And I do spend the majority of the time right there. How I typically start is, I ask them what their experience with food has been, how have they been raised? What sort of nutrition did they have as a child? I want to know what type of diets they've used in the past. And then I go into their 24-hour dietary recall. I have found the most success in that approach. And this is not about perfection, and I love what Karen Collins from the American Institute for Cancer Research says, because she says it's not about perfection, it's about action. And that's just perfect. That coins it exactly how we need to be in medicine. Though some patients come in to see me and they want to be perfect, I will say those patients come in with a lot of turbulence, right? And that turbulence is not something I want to see. I want to see people that this harmonizes their life. This is exciting and empowering to them, and it gives value and meaning over how they're going to have some control over their disease. I don't want them to be so fearful of their disease that they're using nutrition as a way to kind of go against it, but yet in the process, they're becoming negative about it and they're not having a positive experience. So I really try to kind of dig through all of that. But I start with breakfast. And, I'm in the South. I'm in Jacksonville, Florida. So sometimes I kind of look around. I think, is there a camera on here? I don't think people actually eat like this. It's not possible, right? I don't know if it's true. Some people are still not eating very healthy. And the circles, Sharon, that you and I are in, is we see people eating oatmeal, and we see them doing plant milks, and we see them doing, fruit in the morning, whole fruit, right? And maybe a little bit of nuts and really healthy breakfast. That's not the case. I hear women having biscuits with butter and bacon and fried eggs. And, there's maybe no vegetable or fruit at all in that breakfast space. So it's kind of trying to work through that and making subtle suggestions, meeting them where they're at. But I am pretty gung-ho. I mean, I tell them, are you going to be comfortable if I really try to change breakfast around? That's the one meal I really want to change for my patients. And I would say almost 100% of the time, all my patients are fine with me switching breakfast around. So I want to get that breakfast healthy because they're usually doing it on their own anyway. So it's an easy thing to optimize. So I fix breakfast with them. And typically the breakfast we turn to is one that's going to do with oats. And I love berries. There's some super exciting berry research. And if you don't mind, I'll just throw it out there right now. So there was a great study that was recently published, and it's not about just one food. So I really do want to highlight that. It's not about one food, but you cannot ignore the fact that this is pretty exciting. And when the patients hear these studies, they get really excited to hear these numbers. And what it showed is that in breast cancer patients who have just merely 2 servings of berries a week, that there was a 25% improved breast cancer specific survival. I mean, so how easy is that? Again, observational study, but still, it's very exciting to see when patients respond to these sorts of things. And so I encourage them to try to get a half a cup of berries each day. I let them know that frozen are just as good as fresh, and they'd love hearing that because they had thought maybe they weren't able to do that. So work with it that way. I try to switch them, over to a fat-free milk if they're using milk with fat in it. Preferably, I'd rather them move towards a plant milk. That is, my comfort. But as we know, the American Cancer Society, the American Institute for Cancer Research, they really don't have a statement with dairy. They're remaining a little bit neutral. So, I do really practice within guidelines. If a patient wants to go whole food plant only, I'm very excited to work with those patients and transition them from dairy over to plant milk because I have no concerns if someone's avoiding dairy. We do not have to worry about calcium deficiencies. You can get everything you need to get from plant milk. But that's pretty much how I approach the breakfast. And then I let them know, if you're okay, can we go ahead and move on to lunch? We move on to lunch. We move on to dinner. But I usually start with just one meal. I've learned this kind of little push-pull with them. So I usually start with breakfast. And at lunch, I try to kind of optimize it to where I add beans at lunch if they weren't getting beans anyways. I really think it's a lot about what they don't get that matters. So I try to have some beans at lunchtime, and I try to get some vegetables at lunchtime and a whole grain at lunchtime. In dinner, I usually just analyze what they're doing and teach them how to do it a little bit healthier, but that usually is the one that I kind of back off on that first visit.
Yeah.
Hopefully that answers your question, but it's fun. I mean, we have such a fun time, and I share the slides with them. I share a lot of high quality research studies, and they get so interested in that. And we go shopping online. So that's super fun. All my visits are telehealth virtual. So I'm able to pull up the products, and I show them how to look at labels. For example, if they're looking to buy a piece of bread, I can show them, I really like this bread. What I use is I say, this gets an A+. This is my favorite bread. Sprouted bread is what I'd like for them to try to do. And I said, this other bread that isn't sprouted, it's kind of like an A-, and so they have their choice. And then I say, the one you're getting is a C. And they're like, okay, I'm going to get rid of it. So I have a lot of fun with them. It's just a really great time. I mean, my patients are my friends. I adore them. I love them. I learn so much from them, and I'm so inspired by them. So it's just a really wonderful exchange.
Oh, I can hear that in your voice. And I love how you structure the visit to be so patient-centered. I think that strikes such a chord. I think we're so much alike that way because a lot of times in healthcare, visits are structured to be more system-centric as opposed to patient-centric, and the goals that, say, a physician may have that are guideline-driven may not always overlap with patient goals. So I love how you structure it. You mentioned the oats and berries. Can you talk a little bit more about data behind specific things? Like, why do you encourage the beans? Why do you encourage people to do more plant-based milk? Can you explain a little bit more of what the data shows and what's behind your recommendations?
I love that. So, the Nurses' Health Study, there was a great study that was published just last year, August of 2021. So, I mean, that's what's so cool when we see that this studies and this data is just so new. So it was part of the diabetes risk reduction diet. And what they showed among breast cancer survivors who were followed for 14 years, those more adherent to the diabetes risk reduction diet. So, I mean, that is pretty much like a plant predominant diet. It's not a plant only diet, but I really liked what this diet highlighted, especially for women who are coming from a standard American diet. They're newly diagnosed with breast cancer. It's nice to be able to kind of slowly step them into this. And the diabetes risk reduction diet does perfect with that. And so what it basically does is it had an increase in cereal fibers, whole grains, coffee and nuts were seen to be just fine and healthy. Whole fruit rather than fruit juice, high glycemic things were wanted to be avoided in this study. They increased polyunsaturated fats and avoided saturated fats, avoided red meats, and of course, avoided trans fats. And you won't believe what they saw. So after 14 years, they showed that there was a 34% lower all-cause mortality among the women who are more adherent to this diet. But the take-home message from this study that I thought was most special was the fact that women who ate a Western diet before their breast cancer, but decided to change after their breast cancer, had a 23% breast cancer-specific improved survival. And so I think that is just the coolest thing. And, that take-home message for my patients is, listen, it's never too late. We can use cancer as a springboard to lifestyle change. And I'm so excited to, really follow our patients prospectively to see if we actually see, improved overall survival, because so much of what, the leading cause of death for women is really coronary artery disease, heart disease. And so much of what I recommend is very, very good for the heart as well. And had these women never got that breast cancer diagnosis, especially early stage breast cancer, we do cure it all the time. And that's the benefit of mammogram, is doing a mammogram. We find breast cancer early enough so that it's treatable and curable, but introducing them to these healthy lifestyles that can not only help them, have this optimal quality of life where they feel great, but we're also helping to improve their breast cancer survival as well as overall survival. And I think that is the coolest thing in the world. And so in that same cohort, that same nurses' health, study population, they looked at total fruit and vegetable consumption. And they showed among breast cancer patients who were followed on an average of 12 years that there was an improvement in all-cause mortality, and that reduction in death was about 18%. So, it just goes hand in hand. When we continue to follow these studies, it just keeps on evolving more and more very positive evidence that vegetables and fruits and whole grains matter, limiting or avoiding, really avoiding red meat. So red meat, though it hasn't been linked as a carcinogen to breast cancer, we know that it's a probable carcinogen for colon cancer. And so I tell all my patients, you have a colon. I know you do. And so, just simply having like 3.5 ounces of red meat a day increases the risk of colon cancer by 17%. So, that's very, very concerning. So I really try to make that discussion, important to my patients to get rid of red meat. And when we're replacing red meat, I start off with trying to replace that red meat with more plant-based proteins. But then also, if they're not quite ready to go all in with plant only, the fact that they could also use things like poultry or fish potentially to replace that as they start out. And if they're going to be using something like poultry or fish, I talk with them about serving sizes, and I say, maybe rather than doing 4 ounces of that meat, let's just do 2 to 3 ounces. And then as part of your plate with your whole grain rice, maybe add some beans for a little bit of extra protein. But, Sharon, I think one of the most exciting areas that I am really paying attention to right now is protein. And I have been following this research for quite some time. And I think, for years, forever, we have had it wrong. We've pushed protein for so long. And I think that's the culprit of a lot of problem. And, T. Colin Campbell had taught us this, as well as Dr. Walter Longo. So I think this is very, very exciting research with Walter Longo coming out of the longevity diet. And I think we really need to look at, amino acids, especially that of methionine, that is so high in meat products, animal products. And that's the reason that I want my patients to try to transition to more plant-based proteins, because plant-based proteins are going to be the best way to have lower methionine. But we still shouldn't go crazy with plant-based proteins. People just don't need as much protein as we originally thought. And I'm really talking more about people who are less than 65 years old when I say that. Once they're over 65, they do need more protein. But, going back to that breast cancer question, when it comes to, what other foods, in that same nurses' health study that pointed out about those berries, they also showed that 2 cups of green leafy vegetables improved overall survival by 20%. Having nearly a half a serving of cruciferous improved survival by 13%. So super exciting. And then the one thing that they really put a thumbs down on, which I think is just, it's actually shocking to me. I'm kind of surprised with it. But high fruit juice consumption is associated with a poor prognosis. And it actually had a hazard ratio of like 1.33. So who would guess, right? I mean, fruit juice seems so benign, and many patients intentionally drink fruit juice with the thought that they're doing good, but we're stripping the most, in my opinion, one of the most vital things, and that's the fiber. Fiber is so important, and only 3% of our patients get enough fiber. So, I mean, I could just keep going on and on. If you want me to, I'll keep talking. I love this stuff so much. It's so incredibly exciting for our patients, though. And this is how I approach it with them. And they get so into it. And so many of them have already read this. And it's interesting. I have women actually come to see me to be put on a low methionine diet, like indication for a visit. And it says low methionine diet. So our patients are very well read in this space. And so it's important that healthcare providers take the initiative to be equally as knowledgeable as our patients, or if you don't have that interest, to refer your patients to a lifestyle medicine doctor who is passionate about this area of medicine that they can help the patients directly.
Yeah. And Dawn, the numbers that you mentioned, this is increase in just survival. If a woman is coming to you newly diagnosed and they change diet, does it affect the course of their treatment?
Mm-hmm. I really love that question. And that's actually an area that I'm very, very excited to be researching here in the near future. In fact, after our podcast, I have a meeting to work with one of my colleagues to kind of redesign our protocol. That is a very exciting protocol that's going to be asking this exact question with very specific investigation of the tumor's response to treatment in the setting of a very healthy diet. And so what we do know with immunotherapy, so immunotherapy has been shown in melanoma patients to suggestedly, do better when they have a more diverse gut microbiome. And, Sharon, you and I both know the best way to diversify the gut microbiome out of the Gut Microbiome Project is to have a variety of, whole plant-based foods, whole grains, vegetables, fruits, nuts, seeds, spices, those sorts of things. And so they showed in that Gut Microbiome Project when folks had at least 30 different sorts of plant products, beans. I didn't mention beans. I, of course, need to mention beans because that's going to be something I'm going to bring up here in a minute. But when they had at least 30 versus 10 different plant products over a week period of time, those individuals had the most diverse gut microbiome. So I really work with my patients on that to try to think about that diversity, especially in my patients on chemoimmunotherapy. And there was an interesting scientist that actually asked the question about beans. And this was a very small study, but it suggests that beans were one of the ways to really enhance that diversity of the gut microbiome too. So I think we're at the early stages of really truly understanding this. But what I would say, bottom line, if you're getting chemoimmunotherapy, I would really try to increase your fiber consumption. And I try to get my patients up to about 45, 50 grams of fiber a day. There's a very exciting study coming out of MD Anderson that I believe they have their patients on 50 grams of fiber a day looking at this. So very, very exciting things. And, people would think, well, let's just put these patients on probiotics. And that's what a lot of folks did. And what we see is it really seems to be that it's more that wide variety of high fiber plant foods that matters most. So how easy is that? Beyond that, there really hasn't. In the American Society of Clinical Oncology in May of this year just published their exercise, diet, and weight management during cancer guidelines. And they just said there wasn't enough recommendation to say during cancer treatment, we can't make a conclusion yet, but we invite you to do research. And so this is an area that I think there's just this call to action that for those of us passionate in this field, that we've got to make sure we dedicate time to doing research to prove that it matters for our patients. So not only from an outcome standpoint, also we should point our attention to that of quality of life. And I, without a doubt, see such enhanced quality of life among my patients. It's just the most exciting thing. And, I'll share with you this past May for Mother's Day, there was a 5K breast cancer run walk in Jacksonville, Florida. I had 40 of my patients participate in this. I have two incredible, I have chills right now, two incredible stories. So the one young girl was not healthy prior to being diagnosed with breast cancer, made a total change. She had just finished her 11th round of chemotherapy. She ran the whole race. And it was 3 days after her chemotherapy infusion. It gets better. Her boyfriend is a physician. He's an internal medicine doctor. After the race, he was sore and she wasn't. I thought that was so cool. And then my other lady, she was running the whole time. She was a former half marathoner. She had just finished, I believe, her 14th round of chemotherapy, also like 2 or 3 days before, and she was upset at her time. I'm like, these girls are great. So we had a great time. But these were women all in the middle of their chemotherapy, and they're out there walking in the heat, and they felt awesome. So I just see that my women, for the most part, really do well. Now, there's still times, some of these treatments we give are so toxic, and there's still some that, as hard as I try, it's just, it's still really, really hard. So this doesn't mean that everyone's going to, overnight feel great. But I really do see remarkable benefits and quality of life aspects for the majority, if not most, all of my patients. So it's very, very exciting.
Oh, that is so exciting. And you mentioned that you try and encourage people to do more plant protein. How about soy? What do you recommend around soy intake?
Oh, thank you. So here is Mythbuster. So if the audience doesn't listen to anything else, I need you to hear me on this, because still I have patients coming in and they're scared of soy because their doctor just told them. This research has been out for decades. This is nothing new. The original data that came out was data that was done in mice with soy, and mice do not metabolize soy the way humans do. And plus, we really shouldn't focus on preclinical research, right? And so we've said this for so long. And so I don't know why the very, cynical environment when it comes to soy, when it comes to healthcare professionals, is so reliant on this preclinical data. But gosh, if I went to them with any other, plant study that was preclinical that looked amazing, they'd be like, oh, it's no good. It's preclinical. But they still focus on this, rodent study. So this animal-based study, right? So not a good study at all. And what we know, the American Institute for Cancer Research, the American Cancer Society, both of those very large, highly organized, highly respected organizations have said that it's safe for women, including women with breast cancer, to have soy. And so basically, soy has 2 receptors. It has an estrogen receptor alpha, where your endogenous or your natural estrogen binds, and you have most strongly, and you have an estrogen receptor beta, and that's where the soy most preferably binds. And so we know that estrogen receptor beta, it is anti-proliferative, okay, where the soy binds, so it's doing a good thing. And where your natural estrogen binds the estrogen receptor alpha, it turns on proliferation. So soy is very favorable physiologically when we look at its mechanism of action. Now, when we turn that to what does that mean in the human being, because, right, we want to know, what does that mean if the person eats it? So what we have seen is very exciting. And so we know that when breast cancer survivors consume soy after a breast cancer diagnosis, and this was just published in the, oops, I lost you. I don't see you for a minute, but that's okay. Well, I'll get you back in a minute. I'm sure I will. Let me just pull you back up. There you go. I'm happy you're all still there. So what the American Cancer Society showed is that breast cancer patients who enjoy soy after a breast cancer diagnosis have a 25% reduced risk of breast cancer recurrence that was statistically significant. The improvement for overall survival and breast cancer specific survival, the confidence interval crossed 1. So we can't rely on that statistical significance, but we know that there has been data out of the American Institute for Cancer Research that also suggests that there likely is a survival benefit with soy consumption among breast cancer survivors. So very, very exciting. We've known for years that soy consumption throughout the lifespan, especially when it's consumed early on, is likely when it's most important. Again, when the breasts are developing in our adolescent daughters, that's when we want to make sure that they're being exposed to soy at that time. There's definitely, we are not at a place in medicine yet for individualized approach to nutrition. I think we will definitely be getting there within the next decade, but there's some polymorphism. So, Sharon, you may benefit from soy more than I do. It's hard to know. But at the end of the day, no harm. Enjoy the soy. It is important to do more whole soy products, and as whole soy as you can get would be edamame. It's a little bit minimally processed if you have soy milk or tofu or tempeh, soy nuts and those sorts of things, but still, in my opinion, very, very healthy. I would stay away from soy isolate protein powders because they're processed. I don't feel they're going to hurt you, but they're processed, and I want you to avoid processed food. So that's my take on soy. So go enjoy it. And I have so many women that come in, they're like, so that means I can have soy sauce? I'm like, well, soy sauce wouldn't hurt you anyways because there's no soy isoflavones. Be careful of the sodium, but you can have a little bit, I suppose. But what I want you to do is to try to get a little bit of soy every once in a while. I share with women, if they really don't like soy, then I don't push them on it because, I can't guarantee that she's going to get a benefit, but I certainly love the fact that it's a really healthy way to replace an animal protein for my patients. It's great for your heart and great for your bones as well, which is equally as important.
Yeah. And, You started talking about sleep, and we've talked about nutrition and some about exercise. What are other ways that women who've been newly diagnosed can help improve their survival and their outcome?
So I think one thing that comes a lot, one thing that I talk about a lot in my practice is fasting, both fasting during chemotherapy, but we certainly don't have enough data on that to, really make a conclusion. We're in the middle of working on some research protocols with that at Mayo Clinic, as well as just some slow simple little overnight fast. So there was a nice study that was published in 2016 that showed in women who had at least 13 hours of an overnight fast that there was less breast cancer recurrence. So gosh, I mean, how easy is that? And again, going back to Dr. Valter Longo's longevity diet, he kind of promotes like that 12-hour eating window, 12-hour fasting window also. But with this particular breast cancer study, anything less than 13 hours, there was no benefit. So I really do try to introduce my patients to that concept to consider, trying to implement that. And most of them are doing that. This is an interesting teaching point though, and something that I'm not actually comfortable with. I have a lot of women that started fasting before they see me, and they're like fasting right through breakfast. They don't have their first meal until like 1:00. And it's because a lot of Americans like to kind of eat late and snack late, so they're eating all the way up until 9 or 10 o'clock. And so then they're trying to do a 14-hour, 15-hour, maybe 16-hour fast, not because I recommended it, it's just something they read. And so they're missing breakfast. And breakfast is your most vital meal. Your body has great respect for its circadian rhythms and it wants breakfast. That's the best time to metabolize carbohydrates. And we know for years that there was increased cardiovascular mortality in individuals who skipped breakfast. So I tell my patients, if you want to fast beyond the 13 hours, I'm fully supportive of that. But I want you to eat breakfast between 10 and 11. And they like that. And they feel better when they are invited to do that. And then I say, if you need to adjust it, just stop eating a little bit earlier in the day. But, the ideal is to stop eating about 5, 6 o'clock, right? And then start your fasting there and still eat breakfast. But a lot of people miss that. So I think that's a good message for all your listeners. The next thing would be, social connectedness. And it's really been well established that women who have more social ties, including those with breast cancer, have a lower risk of dying overall. So social connections. And in my opinion, loneliness is, people die when they're lonely. So we cannot emphasize enough the importance of social connections. And when it comes to that social connection, for me, that's also a pillar that I uphold that has to do with spirituality. And so this is something very interesting that I pay attention to when I look at the social determinants of health when it comes to resilience. Is there is a question on social determinants of health: how many times a year do you attend a religious service? And I've seen this very interesting, fascinating trend. In any woman who selects 4 or more, right? So it means they're going to church or some sort of a religious, assembly, more than just the main holidays, that these women, when they come in, regardless of what the circumstances are, it could be metastatic cancer, it could be a major family issue, whatever it is, they're going to be more resilient during that conversation 100% of the time. And 100% is a huge number to say, but I have not seen it differently among my patient population. Now, it doesn't mean if they answer that question, it is 0, or if it's 0 to, 2, that they're not going to be resilient. They very well are going to be resilient because maybe they just practice a different level of connectedness or spirituality that they didn't feel that question suited them. But if I see that it's less than 4, I bring that up in my visits. So I do talk about spirituality. I talk about belief in God in my visits, especially when someone's mortality is being faced with them. They're given a diagnosis of cancer. You very suddenly believe in something much bigger than yourself, so it's very interesting. And a lot of people say, I kind of fell away from my religion and now I'm back into it. And we have a very nice conversation about that. And for a lot of my patients, they feel guilty that they don't meditate. That kind of comes from managing our stress. We all have stress. How are you going to manage it? There's great research for, various stress techniques when it comes to breast cancer, whether that's, mindfulness-based stress reduction or yoga. But prayer is just as good. And so I invite my patients to just take part in that. And again, I'm in the South. This is kind of like, the Bible Belt, if you may. So I have a lot of folks that are very prayerful and it's very meaningful to them. And they really love having the opportunity to talk about that with their doctor. And I know for me personally, in my own journey, having God in my life has been something that I just give gratefulness to every single day, that I had that foundational support to kind of give me trust and understanding that everything's going to be okay. So yeah, I hope that part helps. But it's really, that's why I need my 90 minutes. We cover a lot of stuff. I think so. Oh, my note. They were like, okay, yeah. And I have another colleague at Mayo Clinic that he's publishing a book. It may be published now. Dr. Bergstrom, he was one of my mentors. So I will credit him, and I have never credited him on a podcast, but I shadowed him when I was actually designing the integrative program at Mayo, Florida. He is one of our physicians in integrative medicine at Mayo, Arizona. And he talks about what happens in the second hour. That's what his book's going to be on. And it's just fascinating. It's just such a great connection that you're given the opportunity with your patients. And what happens is you don't need to see them downstream. They have less need to see their oncologist for symptoms because they feel better, they're thriving, or, they're attaining such vitality in a way that matters, that downstream, it actually is going to help the system rather than hurt the system, just to give the doctor that 30 minutes extra with their patient.
Dawn, this is such valuable information for listeners who want to learn more from you or even potentially reach out. What are resources? First of all, you said you do virtual visits. So can they contact Mayo Clinic and actually do a virtual consult with you?
They absolutely can. I've been working actually with my administrative team to make that possible. So if you call Mayo Clinic and you are a breast cancer patient, I do really reserve myself for breast cancer patients. I do see some women with female-related cancers, but I am women's health expert, so it's really comfortable for me to stay only seeing women. I have an awesome integrative medicine doctor who does see men. He is wonderful. So we do have other colleagues that can see other disease states, but I stay in that breast cancer space. But if they call Mayo Clinic, and they just let them know that they want to see Dawn Mussallem for an integrative medicine and health / lifestyle medicine consultation. They'll set it up and it's virtual. So that's what's so nice is I'm able to see people from across the country. So
that's great. And if they want to learn more from you, that you are available also on social media, right? So how can they find you there?
So I am on Instagram, and it's interesting. So, when it comes to my own personal, optimal well-being, if I have a lot going on, sometimes I sacrifice my social media. So I try to be active, but I'm not always as active as I would like to be. But I would love for your community to follow me. I'm at Dr. Dawn Mussallem, super easy to find me. And I do try to get more and more active on there. So I would love for you to follow. I'm on LinkedIn as well, just under my name, Dawn Mussallem, and of course, Facebook under Dawn Mussallem. So the usual channels.
Oh, thank you so much, Dawn. And, and I know that this is so heartfelt for you. We didn't get a chance to talk about your personal story, but I know that you have such passion. I can hear it in everything you say and everything you do, because I do follow you on your social media.
I love that we're friends. I love when I see him oh, hey, Sharon, I can't wait to see you on. At least we get to talk this way. This is great.
It is great. So thank you for all the work that you do, and thank you for sharing all the information that you share.
Oh, gosh. Thank you so much. And, I will say that please do follow me actually on the Instagram, especially because at the end of the month, I just don't have the date yet. At the end of October for Breast Cancer Month, I'm going to be having a breast cancer wellness virtual retreat that I'll be talking about the nutrition. I'll have one of my experts in the exercise space talk about breast cancer and exercise, and I'll have my mind-body person talk about mind-body. So we would love for you to come. We do this. We usually do it 1 to 2 times a year. So I'll be posting that QR code once I have that ready to go. So follow me. If anything else, you can join us. It's always free. We do these events. We love to invite people. And typically it's international. So we have people last time it was from 20 different countries. So it was very exciting.
Oh, that's great. So we will attach that and how to find you to the show notes for this episode.
That's wonderful. Thank you again for having me. It's been such a privilege. Thank you for letting me share my passion. I really appreciate it, Sharon.
Thank you so much.